I'm going to show you guys the labs of a 35-year-old female who came in with things like fatigue, anxiety, depression, gut issues. She was having heart palpitations.
That all sounds super serious. Show us your comprehensive labs.
So the first test that we ran was a hormone test because we wanted to see what her cortisol levels look like, wanted to see what her estrogens look like and the balance of them. And as you guys can see here, she gets a poor balance of her cortisol. Normal at the beginning of the day, crashing at night, and then going higher before bed.
So that hormone test was a Dutch test, or the dried urine test for comprehensive hormones that they charge $400 for and then charge you again to bring you back to interpret them. Not a single major medical organization recognizes the Dutch test to be useful or accurate in any way to guide clinical management.
This test right here is a mold test. This individual was exposed to mold in the past, so we wanted to see what her levels look like. And as you guys can see, 4 of them were out of the summary range. They're all toxic to different.
I'm going to reference the American College of Medical Toxicology position statement regarding mold and mold testing. This is going to sound gross to some, but all of us have been exposed to molds. But the majority of it is not from the air we breathe. It's actually our diet. Diet is the most important source of human exposure to mold-related toxins. Which means that if you like corn, ground nuts, dairy products, cereals, coffee, dried fruits, you have some kind of mold toxin in you. But the key thing to remember is that there is no known clinical significance with respect to things like brain fog, fatigue, weight gain, all of those things with respect to mold. That is a scam test to make you think that you are dependent on them.
And then we ran a stool test on her because you can see things like digestion markers. For her, she was dealing with poor protein breakdown and digestion, 2 elevated inflammatory.
This one's my favorite. You don't even try to hide that you're a scam artist. You even put the key, low need for support. Oh, we got to deal with her digestion. It's a 0 by your own test. Why would you mess with it? These are the problems with these kinds of practitioners that think that they're helping people when in reality, they have no problem saying how loudly they actually want people's money instead of actually making them feel better. It's actively disgusting. Don't get scammed. Take back your health.